Thank you, Arfan. I'm very excited about presenting to you about a topic which is really one of my favorites to talk about how you advance your career. And that could be obviously in academia, but could also be otherwise. Even the smallest solo practice will require you to be a leader for your dental assistant, practice manager, support staff, and you might have an accountant and so forth. First, I want to thank the Azerbaijan Dental Student Union team for the kind invitation, and Erfan particularly for being so kind. Um, Before we begin the proceedings, I would like to acknowledge and pay respect to the traditional owners on the land on which I'm at the moment, which is the Gadigal people of the Ora Nation. It is important their ancestral land that I'm presenting to you today. In Australia, we have a tradition that we always acknowledge who was here before us. The University of Sydney, where I'm belonging to, currently celebrates a 175 years anniversary. But learning has happened on these lands for tens of thousands of years, actually 65,000 years, according to some science and nature articles, which means that we only continue a tradition which has happened here for a long time, and we need to be aware of this. And while we do this, we do pay respect to their elders past, present, and emerging. So let me start with a story of how it comes that a person who grew up in a system that did not encourage leadership by individuals and which collapsed in 1989 tells you something about leadership. And it's also a little bit a tale about how my personal career almost got derailed. So it's 1994. I'm in my boss's office in the Berlin Charité. His big windows, even bigger reputation, and he's a famous professor of periodontics. And while he is West German from the former West Germany, he's very strong about his opinions. I'm not old, I'm not famous, and I grew up in East Berlin. But I pitched my idea to him to use the new World Wide Web and graphical browsers to improve dental education and dental research. But he's not convinced. He has a computer on his desk, but it's more like a statement piece. As far as I know, he has never touched it or turned it on. But I see a lot of US-based journals in his shelves, and I connect to that by saying that I want to go to this conference in San Diego where a lot of technical nerds in healthcare like myself are meeting. But he doesn't want to have it. My arguments are not strong enough. I leave disappointed and think maybe this is not the right place for me, where former staff members from the former West get all the research support and the people from the former East get the teaching and the administrative work. The next morning, I'm sitting in front of my computer, and it's the early days of the internet with graphical web browsers, a lot of home pages with blinking icons. But I want to do something useful, so I've programmed an interactive periodontal quiz with clinical images and medical history and histology and so forth to teach my students, and programmed a CGI script to make this all run. I want to go to San Diego and show what I have done there. At this point, conferences do not offer internet connections. So I have devised this rig where I have this 2-kilogram laptop, which I've connected to a ridiculously heavy 10-kilogram docking station, allowing me to run a server at the same time. So I have a plan. I want to go to San Diego. And if that doesn't work out, I might quietly exit academia and research and enter private practice. So 2 months later, I'm entering a huge convention center in San Diego. My shirt is sweat stained because I'm out of breath and walked the 3 kilometers from the hotel to save money on a cab. My boss didn't support my trip, but he allowed me to take annual leave to go there on my own. I'm very suspicious being here in San Diego because San Diego and the US is more West than West Germany. And that's not just geographically, but their use of computers in healthcare is much more advanced than what's in Germany. So I can't really walk around at the convention. I have to go to my session room because I have this setup with me, and I'm really looking like a bricklayer who brought all his bricks with him. Um, so I enter the room in the where the session is running. There are about 100 people in the room, and I feel kind of embarrassed to schlep around my heavy setup there. Um, People definitely look at me. The speaker at the moment is a New York computer scientist demonstrating one of these new electronic health records. And as I watch her present, I become acutely aware of the fact that English is actually my third language. I had to first learn Russian in school. So I'm really feeling very uncomfortable and I want to leave. Maybe I should go to the zoo. I've heard the San Diego Zoo is quite famous. At the zoo, nobody would notice my bad English, and also nobody would figure out that I'm just a dentist without any formal computer information science training. Eventually, they call up my name. I lift my docking station and all this, bring this to the stage. Cables are snaking everywhere. But the audience must, at this point, expect an earth-shattering presentation given my hardware setup. I start demonstrating, everything works fine, my accent is heavy, but the presentation boots and the server runs, and I feel kind of in a balance. But I don't want to stop it. At the end, I pad another sentence to buy time because I don't want that the questions are starting, which I might not even understand, and the inevitable rejection. But eventually, I have to stop. And there's silence, then there's polite applause. And the first question comes from the moderator. And he's a very kind person, and he speaks slowly, and he asks, which company programmed this? And I'm confused about his question because I don't know what to say. Maybe he found a fundamental flaw or something is wrong. That's why he's asking this. And maybe I should ask back something for clarification. But that's stupid because it was a pretty clear question. So I quietly respond, I did. And the room goes still. Time seems to stop. The moderator looks confused, which confuses me even more. Did he understand my answer? Maybe I need to explain a little bit more how I did this with the CGI script and all the programming. But I don't know how to say this in English really well. And then one person starts clapping in the audience. And then the whole room bursts out in applause. And in about 5 seconds, I know that my boss in Berlin is not the world, and there's a world out for me as a dental researcher on the intersection of dentistry and computing. So later in the hallway, people line up and ask curious questions. One of them will become my boss in Philadelphia, where I start a 3-decade-long academic career in dental informatics. But the name dental informatics didn't exist yet when I was in San Diego. Philadelphia is also the city where I get a computer information science degree. And from there, I move on to the University of Pittsburgh, which is a more research intense institution where I mostly do NIH-funded research, always related to dentistry and something computer and information science. So I have a really reckless disregard for disciplinary boundaries. In 2016, I came to Sydney, where I'm now, first as a deputy dean and then as the head of school and dean of the Sydney Dental School. Because of my background, I'm also appointed as the academic lead for digital health for the entire faculty of medicine and health, which means nursing and pharmacy and all the other areas. Currently, I'm also serving as the chair of the Australasian Council of Dental Schools. It's a club of all the dental schools in Australia, New Zealand, and Oceania. So that's a little bit about my background. And I probably should also point out that I work with 2 startups quite intensely. I'm a director in a not-for-profit organization which provides services to 400 people with severe disability. And in fairness, I should also point out that I will finish working at the university in February next year. After that, I will take on the role of chief executive of the Bureau of Health Information in New South Wales Health. That's one of the largest healthcare systems in the world, 180,000 employees and 220 hospitals. So quite a few changes coming up for me in the next months. I also put my disclosures here on the slide, but I don't expect you to read these. You can take a look when you download the slides. So in the next, whatever, 20 minutes or so, I will speak about how I think about leadership in a very global sense. There's a lot of very basic things here, but I will explain how I apply these in my role as academic leader. But all this can be easily transferred to anything you do in leadership in an area which is much smaller or much larger. I also have put a link here so you can download the slides. The QR code goes to the same spot. Please feel free to use this. If you don't catch it now, don't get nervous. I will show the QR code at the end again. And that's really for you to see all the references which I have put on the slides. So let's start with something really basic. Be nice. Everyone is busy. That's not an excuse for not being polite. If you are rude to people, they will see this as an invitation to be rude as well. So how does this relate to leadership? If you're humble and grateful, your people will be humble and grateful. If you're warm and engaging, your people will be warm and engaging. I tell all my mentees to be more generous because generosity creates happiness. Guessing someone else's intention in cases of conflict without having talked to them is a recipe for escalating a conflict and ultimately failure. Many people don't know their own intentions. So how would you guess someone else's intention? So what do I specifically in my role here at the University of Sydney, where the head of school with about 100 staff members, about 200 casual staff members, another 150 affiliates, and about 700 students. I try to be present. Unfortunately, we overuse email as a communication channel, and that has, in my view, multiplied the rudeness of the tone, how we interact with each other. I use public transport and use the time when I'm in the train or on a bus to talk to staff on the phone or join them if they have the same route as I have. We obviously work also from home from time to time after the pandemic, but whenever I'm at the office, so to speak, I'm not in an office locked up. I try to use open spaces so people can approach me and talk to me. That is really important. Try to bring my attention and energy to the present moment. This can be achieved through many things. Some do mindfulness training, others do other things, but it's really important to be present. For instance, when you talk to someone, don't use your phone at the same time. If you have breakfast or lunch with someone, as a business interaction, put your phone away so the person knows that they have your full attention. I always advise my mentees when they struggle and have made mistakes that it's important to change feelings from resentment to resilience. And I don't refer here to resentment to other people or against other people, but against ourselves. We tend to make mistakes because we are humans. I do my share of mistakes, and then we generally think too much about these mistakes and criticize ourselves. And then naturally we start worrying about the future. But how do we improve? Not by beating ourselves up about past mistakes or worries about the future, but by trying again and again. Every athlete and pianist will confirm that thinking about mistakes will not improve performance, but training and practice does. And I think we need to adopt this in our approach to leadership. So then let's talk about humility. You need to exhibit epistemic deference, or to put it more simple, most people know more about most subjects than yourself. And nowadays we should obviously add that AI knows everything anyhow. So no reason to get depressed. Humility is a necessary ingredient for learning. It's a virtue that acknowledges one's ignorance while being open to learn. I believe the phrase, I don't know, is a sign of maturity. When I was a young man, I couldn't say these words. They were words of shame. Now I can't go through a day without saying a dozen times, I don't know. Um, you also, if you are in a leadership role, should share information. Nothing confidential, obviously, but don't use information to have the upper hand. Mirroring my secular beliefs, admitting blunders is just part of the game. And power, too much power, causes brain damage, as you can actually see in fMRIs. And I put this article here on the slide. So what do I do in my current role? Contrary to popular business wisdom and advice, I don't believe there needs to be a clear separation between private life and public life. Old school views saw expressions of emotions and vulnerability as mistakes. But I think the younger generation now really sees this more as the glue that binds us together. So I try to have strong relationships to staff by sharing personal stories and experiences. Simple things can make a difference. For instance, when I meet students, I let them know that both of my daughters studied at the University of Sydney. One did the Bachelor of Commerce and is done now. The other one is still in the program for psychology. So I have much more insight into student life at our institution than you would normally think a dean would have. I make time for lunches and coffees with staff. I hang out with junior academics. I can tell you that's the best medicine against aging. I use walks for talking to people and when I travel between different campuses. We really all need to maximize time. There are only 168 hours in a week, and we must use them wisely. And I have put on this slide here a book by Keith Ferrazzi, Never Eat Alone. It's a little bit cheesy and more geared towards business, but clearly it brings home many lessons dentists and academics should embrace, but usually don't. They usually work alone. Lastly, I also try to share what I call a purpose statement, explaining where my own motivation comes from. If you explain to your staff where your motivation comes from, that helps them to better understand you and support you, obviously, at the end of the day. So that could be a magical childhood moment, how your career was influenced, where your core values come from, maybe it was your upbringing, and where are limits to your beliefs and where your shortcomings are. For instance, I have limited tolerance for people who are self-centered and egoistic. It makes me more upset than it probably should, and I need to work on that. So there's a lot of things you can learn in that space and improve. Be helpful. I try to model Adam Grant's undiscriminating helpfulness that actually reaps in professional benefits. If you don't know Adam Grant, you should read his book, which I put here on the slide. And Adam Grant is the youngest tenured, highest rated professor at Wharton Business School, often ranked one of the best business schools in the world. And I can say this here because nobody from my institution is here, which also has a business school. So let me quote something I read about Adam Grant. People like him are strategic in their giving. They give to other givers and matchers. So their work has the maximum desired effect. They give in ways that reinforces social ties and consolidate their giving into chunks so that their impact is intensified and gratifying. So how does that relate to successful leadership? I always try to be helpful. There's a lot of talking about that you need to learn how to say no, but I actually disagree with this. Doesn't mean you have to do everything. You can always connect someone requesting help to other people who are more suitable. They might have more time, and you might have to nudge them, but a flat out no doesn't bring you anywhere. So here at the University of Sydney, in my role as head of school, there are many gestures of formal recognition where I try to praise staff who actually help others. And we have a shout out app where we can actually give kudos to someone who actually as nice to work as and helps. We obviously need to be careful with giving feedback. I don't know if any of you have read Dave Egger's book, The Every. It's a follow-up from the book The Circle, which made it into a movie with Tom Hanks and Emma Watson. And The Every is about giving feedback and what happens and which dystopian environment we can enter if we give too much feedback. And I'll leave it at that. You need to read the book on your own. So build resilience. Work and learning as a dental student is not wall-to-wall awesomeness. Your job as a leader is to always answer the question, what am I doing to ensure that people enjoy working here? When in a good mood, people become more intuitive, more creative, as Nobel Prize winner Daniel Kahneman has scientifically proven. The things you learn when you mature aren't simple things as acquiring skills and information. You learn not to engage in self-destructive behavior. You learn not to burn up energy and anxiety. You discover how to manage your tension. You learn that self-pity and resentment are among the most toxic drugs. And you find the world loves talent, but pays off on character. You come to understand that most people are neither for you nor against you. They are thinking about themselves. You learn no matter how hard you try to please these people, some are just not going to love you. And it's a lesson which is probably first troubling, but then quite relaxing. As a leader, I should never complain. A single complaint by a leader can create a negative, unwritten rule that undermines an otherwise positive culture. I think at the moment in our society and media, there is really a trend to be more criticizer rather than a doer and more tearing down than building up. And I think we need to work against that. There's a lot of things to be said around motivating people with positive utterances and positive things you have to say. And then when you're in any role, no matter how big or large, you will have to think about career advancement. And you need to acknowledge that 10 to 20% of your work life will be spent on non-value added activities. So for me, these are standing meetings. They are not relevant to my area, but my presence and visibility enforces my place. Such meetings might feel like an interruption in your ability to do creative work. But you need to convince yourself that this is kind of an investment forward of your work, which is required by your institution organization and pay dividends over time. So there's no real value in getting worked up about this each time you have to attend a meeting you don't like. And then you want to enable change. It is hard to change others' behaviors, especially with a lot of, in my case, intransigent academics I have to deal with. Impressions are remarkably perseverant, and you learn the limitations of reasons. Why facts don't change our minds is a New Yorker article that really resonated with me, and put a link here on, obviously. Charisma helps, and the good news is you can learn charisma. Oops, sorry. John Updike says that we have a natural resistance to being told what is good for us. So what can we do about that? For me, it works when I tell stories. I believe that humans need a causal narrative. We are not built for reasoning by numbers or evidence, as much as we like to say, and as much as in dentistry we say it's all evidence-based and we go by guidelines. It's a lot about stories. So I do research on behavior change of providers. And again, we have seen in this research that knowledge is not a barrier for change. And that's why knowledge shouldn't be targeted for behavior change. It's motivation. And be a storyteller about the future is really part of being a leader. Weave your audience into the story so they see themselves in this proposed future. Getting to a shared vision in a relationship, community, organization requires engaging and embracing conflict and thoughtfully resolving it, not shying away from it. So at the moment, there's a lot of disruption happening with AI. Think about how you can embrace this and how you can help to move into the future. So think and work strategically. As a leader, you're supposed to work strategically, not operationally. But be aware of prioritizing strategy over action to a degree that removes you from the action. There are a few things here on the slide which all can be summed up in: if you don't know where you're going, you're unlikely to arrive. And there's always a tension between leadership versus management, and finding the right balance is a challenge. Field Marshal Sir William Slim, Governor General of Australia, wrote in 1957, "Leadership is of the spirit, compounded of personality and vision. Its practice is an art. Management is of the mind, more matter of accurate calculations, of statistics, methods, timetables, and routine. Its practice is a science. Managers are necessary, leaders are essential." So what you want to do is assess your peers and your superiors frequently. Imagine yourself sitting on a balcony, watching the people in your organization. You will find self-interested careers. You will find servant leaders, the manipulator, the fair weather friend, and many more types. So what can you do about all this strategy and management? I think it's important to abandon big project pipelines that deliver this big bang result. It's much more important to have tiny wins. It's important to have pilot projects, to engage others in what you're doing, instead of trying it all on yourself and having this big thing which then eventually comes out. And again, it's often phrased as pilot projects, low-hanging fruits, participatory leadership. The principle acknowledges that with increasing age and professional advancement, my sense of epistemological modesty has intensified. And with that, I do not refer to political, scientific, or religious matters, but to the understanding how little we know about the effects of our decisions, as the world around us is immeasurably complex. What we want to do is fail forward fast. The idea is if you're not failing from time to time, you're not doing enough. Obviously, it's important then to learn from your failures. So to tail forward means an iterative process to do again. However, that's very easily said. And despite of the conference keynote pabulum that failure, you have to fail fast and often, the truth is, financially and psychologically, failure really sucks. In most companies, projects that don't work out are stigmatized and their staff are fired. I've read a very interesting article about X, Alphabet's moonshot factory. The entire article is quite interesting, but the part about how they handle failed ideas and how to handle them as a leader really inspired me, and I learned a lot from that. So then be smart. We have a Cambrian explosion of new technologies. And what does that mean for leadership? We need to upend long-standing theories of managerial cognition, which says we don't no longer make decisions under conditions of information scarcity. We actually increasingly make decisions under conditions of information overflow. Abundance of information also implies increased competition for the attention of individuals, groups, and organizations. So be aware that any information consumes attention. So we need to develop 21st century skills such as transactive memory, knowledge of who knows what. But nobody taught us this at school. Many of you use AI on a daily basis. How are you interacting with this? How are you using this? Nobody has taught us this years ago. Others argue there's no information overload. It's always a failure of filter. So it's a question of how can you handle a lot of information and where do you put it? If you put it in OneNote or in little sticky notes, doesn't really matter. But you have to find a way to manage information, because one of the frustrating feelings about the human mind is its Lilliputian capacity of storing and retrieving important but infrequently used information. It's a human problem. There was no hardware upgrade in 160,000 years. So being smart will mean something completely different in the age of AI. We as humans are confirmation-seeking thinkers and ego-affirmative-seeking defensive reasoners. We will need to overcome these proclivities in order to take our thinking to a much, much higher level. So what do I do in my role here at the University of Sydney? I think it's a meta issue. It's the importance of getting an understanding of how to deal with different thought words, how to distribute information across organizational groups. Expertise location issues come in. From a health IT perspective, we have what we call the 5 R's: the right information to the right person in the right format through the right channel at the right time. I'm trying this with the design of electronic health records for almost 3 decades now in my research. And honestly, it's not much to show for. It's very, very complicated. We need to keep in mind that electronic health records, even after decades of development, are still often kill patients in hospitals because they're not well designed. So it's really important to think about how we develop these new skills. And I put a few books here from Yuval Noah Harari, which I highly recommend you read. And lastly, and here I have to admit I'm certainly not a shining example of doing the right thing. We need to sleep well. That's important. I only need 5 hours of sleep, spending most early mornings working on research projects and conference calls with the US, here from Australia. Today's connectivity creates the expectation that you're always available. As a senior leader, you often have to work on weekends to deal with crises, not just the pandemic, but all kinds of things, which happen to close to 1,000 people I'm responsible for. But you also need to take care of yourself, and you need to take care of your brain. Some of the facts from the book, Why We Sleep, are rather convincing, I have to admit. And Matthew Walker is not a sensational science journalist, but a professor of neuroscience and psychology at UC Berkeley and director of the Sleep and Neuroimaging Lab, former professor of psychiatry at Harvard University. So he knows what he's talking about. And let me just give you 2 nuggets from his book, which really influenced me. With the EU harmonization, Greece was forced to abandon siestas. Shops stayed open. Work continued during the lunch hours. And even after controlling for all other factors, they experienced a 37% increase in cardiovascular disease. Walker did an experiment with learning of college students, and don't want to go too much into the details, but one group had a proper night's sleep and the other group pulled an all-nighter. And after 2 full nights of recovery sleep, they tested how much they can learn. And it showed that the group which had the all-nighters 2 nights earlier showed a 40% deficit in their ability of learning and cramming new facts in their brain. So after 2 nights of full sleep, they still saw an effect there. So how I do this at my work here at the University of Sydney, we all know there are morning larks and night owls, and evolutionary reasons for this increases to have the chance as a pack that someone is around to defend you in the morning as well as in the evening. So allow yourself and others to follow your pattern. One of my best staff members here in Sydney is useless before 9 a.m. Well, I will not schedule a meeting with her before that time. So why would I do that? So I acknowledge that she's better when it's a little bit later in the day. So I would like to acknowledge my collaborators. They are all the ones who have the cool ideas. I just pull them together. I also want to put in a shameless plug for my newest book. I had, after a lot of encouragement from mentees, to share my insights a little bit more broadly. I have a weekly leadership newsletter. It's called Leadership Travel Guide. I do this now for a while. It's in the 231st issue this week. And it attracted more than 1,000 aspiring and experienced leaders. And then many of these subscribers asked me, can I give a more detailed, concise, shorter guide around leadership lessons? And responding to this demand, I compiled these insights into a comprehensive resource now published as a path to academic leadership, 8 lessons to advance your university career. But it's way beyond university career. That was more a suggestion by the publisher. So it is more about general leadership. Again, here's the tiny URL with the slides or the QR code, whatever works best for you. There's a link to my leadership newsletter, which is available for free. Links to other papers and profile and so forth. So with this, I will finish sharing. And I'm very happy to answer a few questions if you
Thank
have
you so
any.
much, Doctor. So we will have a Q&A panel right now. So guys, feel free to write down your questions in the chat box. And I have to say thank you, Doctor, for the opportunity. It's really great. I'm really grateful to see you here. I've been following your newsletter for it's almost 1 year since I got to know about what work you've been doing and the articles that you've been sharing through the newsletter. And I just have to say thank you for the opportunity. Thank you for being here, and thank you for giving us your time.
Yeah, of course. So I see the first question with how to express them without coming off as incapable. So I think it's really important to differentiate mistakes and errors or whatever you want to use as a nomenclature. Obviously, if you work sloppy and make mistakes because of that, that's not a good thing. And you still need to acknowledge that you made a mistake and do better next time. But I think what's important is if you do a project well, you put in your best effort, it still might fail. And I think then acknowledging it and expressing immediately what you have learned from that, how it can inform the future, will make sure that you come across as someone who is reflective, thoughtful, and actually quite honest, and you show humility. So I think that is really an important part of showing that you can learn and improve in the future. And I don't think anybody, at least in proper leadership and management, will punish you for or think bad about you if something doesn't work out. Not everything works out. I clearly had a lot of projects which I tried and were not successful. And that's okay, but you need to learn from it.
I have a same scenario question. So when it comes, like you say, Doctor, it is easy now for you to say, I don't know, or to say, I don't know. But depends on the place where we are, the culture, it might affect how people see us as leader, rather it be in team or even patients. How do you manage such a scenario when you have to, let's say, keep a face?
Yeah. Yeah, I mean, I think it's always a question of how this is phrased in the bigger story. So, for instance, when you deal with a patient, I don't think you want to come across as someone, oh, I don't know, let me try that. Rather, you want to come across as someone who's very thoughtful and say, well, I don't know exactly how to do this, but I will consult with a senior colleague or read the literature or do this or that or the other, and I will get back to you. So, you again, you don't want to come across as someone who doesn't know and doesn't care. Not knowing, as I try to say, is an opportunity and a trigger for learning. So I think that's really important. And then not knowing is also something where you probably do differently between your superiors, whoever you work with. where you might phrase it more like something, oh, I put this on notice, I will give you a detailed answer next week, or whatever the context is, versus with your team, where you want to be more honest and come across as a real human instead of this know everything leader and boss, which might impress some people, but at the end of the day, it turns them off. I think you want to have the closer collaboration. So it's always a question of how you phrase things instead of this categorically, this or that. Oh, Sophia has another question. How do we embrace AI without losing? Yeah, it's interesting. So just should probably tell you this, I just did a tour of 5 cities here in Australia, speaking to dentists about the ethics of AI. About 1,000 dentists in the audience combined in the 5 cities. There was also a panel discussion afterwards with a couple of leaders and entrepreneurs from the AI space. So there are a couple of conclusions from that, not just from my talk, but from the discussions I had with these panel members as well as the audience there. First of all, at the moment, AI in dentistry is mostly in the administrative and practice management area, like, answering machines, so to speak, having an AI agent. There are a couple of island solutions like Invisalign, obviously, or sequential aligners, CAD/CAM, design of crowns, and so forth. But it's not like a holistic thing. I don't think we will see very soon AI or anything doing what we as dentists and clinicians do all the time, guiding someone in pain through a treatment process to better oral health outcomes. That goes far beyond finding the right diagnosis and just doing things. It's a lot of human connections and interactions. Patients really want to have a clinician in the loop. They, generally speaking, like if AI is consulted, if there's a good mechanism to find diagnosis. But at the end of the day, they want to interact with a human and they want to know that this human is in the loop. And I think that applies not only to healthcare, but to other areas as well. AI is currently not very reliable. I don't want to give you a talk about AI. It's obviously a probabilistic approach, not deterministic, which is the beauty of AI, large language models. It allows them to understand questions poorly formatted, poorly set, but it also means it sometimes goes off the rails. And we certainly want to disclose to patients that we use AI, if we use AI, for instance, for scribes, for taking notes or something like this. But we want to assure them that we will apply our professional judgment and not just blindly do what AI says. I think we need to increasingly deal with the fact that intelligence is substrate independent. That means it's not just biological. We all have a certain carbon chauvinism that we think everything needs to be biological. I think that's wrong. But humans want to interact with humans, and I think that's why healthcare in general is a fairly safe space when it comes to the implementation of AI. I'm working with a company together which works hard on interpreting radiographs. You see this in my disclosures, Eyes of AI. So that's all fine and good, but it doesn't mean the clinician will be removed from the area. So I think you are well off as dental students. I've just read yesterday something from a lawyer who said, a high up lawyer somewhere in the US, who said like everything from first to third year associates is now done all by AI. And so they barely hire any new graduates from law schools. So be glad you study dentistry and not law or other areas which fall into the same group.
Guys, any other question?
Something else